Our next question was actually submitted to us by a veterinary professional, and we all know that there are many pets who dread a trip to the vet. But it's not just about that dreaded trip to the vet that we're talking about in this question. This question relates to what happens when that pet is now at the vet and the animal needs to be accompanied into the back of the practice by the veterinarian or an assistant for some type of procedure, whether it's a blood draw or to have x-rays. And the concern in this situation is that the pet doesn't want to go. They've tried to lure the pet into the back with treats, and it's not successful. They also allude to the fact that it may not be an option in some instances because a pet has food allergies or food restrictions, and they don't want to drag the dog into the back of the practice, but they don't know what other options they have, particularly in a dog of this size where you can't just pick them up or put them into a carrier and take them into the back. So the question is, what do you suggest? I'm going to ask Dr. Christensen to take the lead on this one.
This is such a great question. I could spend probably 3 days answering this question. I'm not even kidding you. We do entire lectures on this type of question. There are some wonderful resources at Fear Free on this from Marty Becker. The thing that I would say just at first blush with this scenario is that if the animal is normally food motivated and today he or she is not, because of what you're doing, then your animal is in the category of yellow animals. And I think we even might have done a lecture on this, Dr. Berger. I can't remember, on some low-stress stuff in veterinary clinics. Yellow meaning this animal is in a danger zone about to get to red, meaning so fearful they're panicking and frozen, or panicking and urinating and defecating, or panicking and attempting to bite to get away. And green would be a dog that's taking food and happily coming with you. So with that in mind, depending on how everything is going with this animal and how urgent things are, if things are not urgent, what I would do is, one, anything that can be done in the room with the owner present should be done in the room with the owner present. At that point, the animal may take food or be interested in play, or potentially be reinforced by petting. Remember, not many dogs are reinforced by petting in the veterinary office. But those are the things that I would assess. I would start playing a game with the dog, and these are all things that we would do well before this problem happened. But if we start to see this problem, then we would start some games or fun obedience cues that the dog already knows. If the owner is very agitated, we might actually separate them, but for many dogs, they're going to be less anxious with the owner present, and that is going to allow you to do more of your medical care. If the situation is that this animal really needs x-rays, for instance, and the animal is too fearful to go back on its own, and for instance, sometimes we try the little trick of having mom or dad walk with the dog a little bit towards the back area if it has to go to the back, and then get the dog in the room where you need him or her, and then remove mom or dad if they must be removed, but otherwise keeping them there. Then at that point is a good time to suggest either a rematch, meaning send the animal home if you can, if the x-rays, for instance, are needed, but not needed now. And then prepare better for the next appointment. And again, there are entire lectures on this that I and my colleagues do, or that my colleagues and I do. And the other option is if the x-rays are definitely needed that day, then this is an animal that it might sound extreme, but I would definitely recommend sedation for, that has an anti-anxiety component as well as an amnestic component. We want to control fear, panic, and anxiety, and we want this animal to feel like they are experiencing missing time, right? They shouldn't remember what happened at the veterinary clinic, because especially x-rays are very scary for dogs because, and all species, probably even many people, because especially in veterinary medicine, we are required to do a lot of physical manipulation with these animals, sometimes into painful positions and certainly into extremely vulnerable positions. So if the dog is not comfortable, one, you're not going to get very good x-rays because you're going to be wrestling the dog. And two, that dog may be much, much harder to get follow-up care done on because you may very quickly accelerate his fear and panic in the veterinary office. So that's the semi-short answer, but lots and lots of really great work being done on this right now so that we can help our colleagues in veterinary medicine know when to be really proactive about using sedation or anesthetic protocols for these fearful guys or fearful and aggressive guys, and also how to keep the dog from getting to this point so that you don't have to use sedation as often. And the other thing I would say is that it might be tempting for some people to suggest that a dog who is balking at going to the back is being dominant, and I would counter that there's probably no realistic research to support that. Rather, the most realistic thing that is going on as far as motivation is fear. All right, Michelle, it's all you.
Well, I mean, from a trainer's perspective, I think for us, it's we've all been in that situation, seen that situation with dogs. I've had it with my own dogs, with one of my rescues. He's terrified, absolutely, at the vet. So as a trainer, I knew there were things that I could do to change that. And I not only changed it for myself, by using techniques teaching my dog to stand for exam and to open his mouth on his own, so we don't have to pry his jaws open to look at those teeth, and things like that. And I incorporated that into some of my puppy and adolescent training classes so that clients would understand that the visit to the vet it's an opportunity to train. And to teach the animal that going to the vet is not a bad thing. And we start small with things like getting on the scale and walking into the exam room and just meeting the vet. And there are great veterinarians out there that will help you incorporate these things. And I'm sure there are a lot of them on this phone call right now. So I think that's kind of the first step. Obviously, that doesn't help you when you're right that minute when you're in that situation with the dog. And of course, you gave them some great options for that. And I think sometimes as the client, the dog owner, doesn't know that they have options. They think that maybe their only option is to let their dog be drugged to the back. And I know most veterinary staff doesn't want to do that. The owner doesn't want to see it. The dog certainly doesn't want it. And I think that definitely in veterinary practice it's becoming more the norm for that whole team of people to be working together to help the dog have a better association with the veterinarian in the first place, train some of those handling behaviors, and then have the options with medication and stuff that you suggested. And I think that's going to get us to a great place.
Thanks for that input and some great advice there. And Dr. Christensen is correct. We do have a whole hour that you did present a few months ago on fear of the veterinary clinic and veterinary procedures. It was actually quite a popular session. And so for people who are interested in this, I invite you to view this. It's an hour long and some great and helpful advice there.